Hello everyone. Today, we're diving into the world of a medication called isosorbide mononitrate, commonly known by its brand name, Imdur. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Isosorbide mononitrate, often recognized by its brand name Imdur, is an oral medication that belongs to a class of drugs called nitrates. Its primary function is to prevent chest pain, angina, in individuals with a certain heart condition, coronary artery disease. It works by relaxing and widening blood vessels, allowing blood to flow more easily to the heart, thus reducing its workload and the amount of oxygen it needs. This medication does not relieve an angina attack once it has started but is used to decrease the number of angina attacks over time. It's important to note that isosorbide mononitrate is not intended for immediate relief of chest pain. Instead, it's typically taken once or twice daily as prescribed to maintain its therapeutic effects. Warnings: Isosorbide mononitrate comes with its set of precautions. It's not intended for individuals who are taking medications for erectile dysfunction, such as sildenafil, tadalafil, or vardenafil, as the combination can lead to a severe drop in blood pressure. Furthermore, it's not recommended for those with severe anemia, increased intracranial pressure, or a history of allergic reactions to nitrates. If you experience a sudden drop in blood pressure, symptoms might include dizziness, lightheadedness, or fainting, especially upon standing up quickly. Before taking this medicine. Before starting isosorbide mononitrate, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its components. Given its impact on blood pressure, those with hypotension or other cardiovascular conditions should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of your blood pressure and heart condition is advised for those on this medication. You should not take isosorbide mononitrate if you are using certain medications for pulmonary hypertension, such as riociguat, or have a history of severe hypotension. It's also important to inform your doctor if you have ever had heart failure, kidney disease, liver disease, or a recent heart attack. If you are scheduled for surgery, inform your doctor as you might need to stop taking isosorbide mononitrate temporarily. Side effects: All medications can have side effects, and isosorbide mononitrate is no exception. Some individuals might experience headaches, which are a common side effect due to the vasodilatory effects of the drug. These headaches often diminish over time as your body adjusts to the medication. Other possible side effects include dizziness, lightheadedness, or flushing. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there's a risk of severe hypotension, especially in individuals who are dehydrated, overheated, or taking other medications that lower blood pressure. Symptoms of severe hypotension include fainting, severe dizziness, and lightheadedness. If you notice any of these symptoms, seek medical attention immediately. Another potential side effect is the development of a rapid or irregular heartbeat, which should be promptly reported to your healthcare provider. In rare cases, individuals might experience an allergic reaction, characterized by rash, itching, swelling, severe dizziness, or trouble breathing. If you experience any of these symptoms, get medical help right away. Furthermore, isosorbide mononitrate may cause serious side effects including severe hypotension, which can be life-threatening. Symptoms include extreme dizziness, fainting, and feeling lightheaded, especially when standing up. It's also important to note that abrupt discontinuation of isosorbide mononitrate can lead to a rebound increase in angina attacks, so always follow your doctor's instructions on how to taper off the medication if necessary. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Isosorbide mononitrate might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Particularly, avoid combining this medication with drugs for erectile dysfunction or pulmonary hypertension, as this can lead to severe drops in blood pressure. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking isosorbide mononitrate. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of isosorbide mononitrate for most adults is 30 to 60 mg once daily in the morning, which may be increased to 120 mg once daily if needed, depending on how you respond to the medication and based on your doctor's advice. It's important to take this medication at the same time each day and not to crush or chew the tablets, as this can release all the drug at once, increasing the risk of side effects. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid. While on isosorbide mononitrate, it's advisable to avoid activities that require alertness until you know how the medication affects you, as it can cause dizziness or lightheadedness. Avoid standing up too quickly from a sitting or lying position to reduce the risk of dizziness and fainting. It's also recommended to avoid alcohol, as it can exacerbate certain side effects and cause a significant drop in blood pressure. FAQ. Many wonder about the age restrictions for isosorbide mononitrate. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of isosorbide mononitrate. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.